Uh, Good evening, everyone. Good evening, everyone. Before we start, I would like to take permission from our General Secretary of National Council of Churches, Reverend Dr. Asir Ebenezer. Can we start our webinar?
Jyoti, please go ahead.
A very warm welcome to everyone, and it's such a pleasure to have all of you. This is the second in the series of webinar on children. The first we had was last month, where we talked about the evil of child labor. So it was on the Eradication of Child Labor Act Day, Eradication of Child Labor Day. And after that, now it is second of the series where we are talking about health and its effect, the COVID-19 effect on children, on their health, physical and mental. I will now request our General Secretary of National Council of Churches in India, Reverend Dr. Asir Ebenezer, to please formally welcome us and set the mode on start.
Thank you, Reverend Jyoti. It is indeed a great joy to welcome each and every one of you on behalf of the leadership of the National Council of Churches in India and the leadership of the All India Sunday School Association. We do realize and we do know that children are a heritage from God. We know that children are unique. They have their own identity. They have their own rights. They have their own space. COVID has added to the factors that make them vulnerable. It becomes the responsibility of civil society organizations and faith-based organizations like the church to help children secure their rights and dignity and their space, and in this context, their right to good health. In the context of COVID, their right to good health and healthy environment takes precedence over everything else. And it is our responsibility to make sure that they are secure. In the absence of a vaccine, it becomes all the more important to look at how to help children secure for themselves a good environment, a healthy environment. I look forward to this webinar, particularly to hear from the resource persons on how we as adults can play alongside children in making this context a healthy context for them. Sunday school is a vast network. We are 14 million people in the family of National Council of Churches in India. Out of this, I presume that at least 3 to 4 million people will be children. That's about 30 to 40 lakhs. There are thousands of Sunday schools across the country. God has placed this ministry in our hands, in the hands of churches, and we will use this ministry to the fullest in this context of COVID in order to secure them. We suffered during the second wave, and we do not want that to happen in the third wave. God will help us to be prepared so that our children and us together, we will be safe and we will save everyone from, God forbid, if there has to be a third wave. I want to thank the resource persons for this evening for making themselves available to us with their rich experience to share their expertise and experience with us so that we could be effective ministers of God in this context. I congratulate my colleagues, Reverend Jyoti Singh, Executive Secretary for Women's Concerns and Child Protection, Mr. Angelius Michael, the Acting General Secretary of All India Sunday School Association, Mr. P.V. George, the Director for Operations in All India Sunday School Association, and also Dr. Sunita Abraham from the Christian Medical Association of India, who have put this together for us. I recognize the presence of Reverend Dr. Ike Joseph and Bila Kochama, who have been forerunners in this ministry, who's a former General Secretary of All India Sunday School Association, and for many years has served the National Council of Churches in India as its General Secretary as well. Thank you, Aipachan and Bila Kochama, for being with us. Back to you, Reverend Jyoti.
Thank you so much, Reverend Dr. Asir, for setting the tone of it. Before we go any further, it is such a privilege to see the smiling and enthusiastic face of all the children who have joined us. Welcome, dear ones, because this is for you, so that we can stand with you to give you what you want. So I would like to welcome all the small children who have joined us today with a round of applause. If all of us can clap for them. Thank you, dear children, for joining us. Our webinar would now be moderated by Ms. Biji George. She is the senior educator and headmistress of Sunday School Marthoma Syrian Church, Nagpur. Over to you, Biji ma'am, to take forward this webinar.
Thank you so much, Reverend Jyoti. It's been a pleasure to be on this platform once again. And as we always say, ISA has always been at the forefront of attending to all the issues whenever it rises as a concern for our Sunday school students and the parents and teachers involved. ISA, as we all know, is a related agency of the National Council of Churches in India. And the main concern of this organization is promoting Christian education in and through Sunday schools of its member churches. So bringing greetings from ISA to all of you will now be Angelis Michael, the acting General Secretary of ISA. Over to you, Angelis.
Good evening, all. I want to thank God for this opportunity to have come to this wonderful platform. As I already see, about 100 people have joined this webinar, and we are really thankful to each one of you for taking your time out. I would like to bring greetings from the leadership of the All India Sunday School Association, in particular, the president of ISA, Bishop Dr. P.C. Singh, who also happens to be the president of the National Council of Churches in India. I also like to bring greetings from the Vice President, Reverend James Hill. I presume that he also is present. I want to acknowledge the presence of the members of the governing council of ISA, including Reverend Dr. Ibe Joseph and Leela Kochama. Reverend Dr. Ibe Joseph also has served the ISA as its General Secretary. So thank you for being here. I also want to thank the leadership of the Christian Medical Association in India for your journey with the National Council and also ISA in the last days, particularly on the issue of health. As it was already shared by Reverend Asir Ebenezer, who also is on the Governing Council of ISA and the General Secretary of NCCI, that how children, in particular during COVID-19, have been impacted to a large extent. There are more than 2.2 billion children in the world who constitute approximately 28% of the world's population. Throughout the world, an essential modus of prevention for COVID-19 infection has been isolation and social distancing strategies to protect from the risk of infection. On these grounds, since January 2020, various countries started implementing regional and national containment measures or lockdowns. In this backdrop, one of the principal measures taken during lockdown has been closure of schools, educational institutes and activity areas. These inexorable circumstances, which are beyond normal experience, lead to stress, anxiety, and a feeling of helplessness in all. To address this today, we have eminent resource persons, Dr. Winsley Rose, Professor, Department of Pediatrics from CMC Vellore. We are thankful to you, sir, and also Mrs. Rina John, who will be talking about the mental health of children in today's COVID-19 context. We thank you as well. And I want to thank Busy for moderating this important webinar. I want to thank Reverend Jyoti for leading this webinar from the beginning in planning and in doing entire planning and moderation of this. I also want to thank our friend, colleague who is committed to all technical technicalities of the webinars of NCCI, ISA, PV George. Thank you so much. The entire team of the All India Sunday School Association, placed in different parts of India. We call them regional coordinators, and also outside India. So I want to take this opportunity to thank each one of you for putting your time together, putting your energy together to bring so many people together to this platform. I want to wish this webinar a success. Thank you. Over to Busy.
Thank you, Angelus Michael. During the time of the pandemic, we've all experienced different kind of health issues. Now, this brings us to one very common quote that we've all learned as school students. And I'm sure that we will all remember the times when we have written ample number of essays on this quote. And the quote is, "Health is wealth." Now, this is a common quote, but I think this was the most thought about during the pandemic times. During the pre-pandemic times, I believe health was never a primary concern for most of us. Hectic schedules always kept us on our toes. Irregular eating habits led to irregular lifestyles and then to poor health. The pandemic surely taught us a good lesson that health is wealth. And health and wealth are so very well interconnected with each other and interwoven that we cannot think of a fabric of ourselves or our society or a nation without good health. The second lesson that we all must have learned, I'm sure, is the second quote that we have always learned in school, that an apple cannot surely keep the doctor away. So we at ISA have taken this baby step to help you rethink about these health issues. And to tell you more about this, we have the first resource person for the evening. He is Dr. Winsley Rose, a pediatrician who specializes in pediatric infections, and he works as a professor of pediatrics at Christian Medical College, Vellore. So it's over to Dr. Winsley Rose.
Thank you, Ms. Biji. Am I audible enough?
Yes,
okay.
Yes, sir.
So I must confess that actually this is probably the first time I'm actually talking to a group of children other than the ones who come to me as patients. So you might have to, I hope the content is appropriate for the children and for the teachers as well. So I'll try and share my screen and then we'll start. So is my screen visible?
Just coming on, sir. It's not yet visible, sir.
Okay. Like while the screen is getting uploaded, I think we're all getting used to this digital world where we sit behind computers and interact with each other. I must thank NCCI and the All India Association of Sunday School Association for this opportunity. And what I'm going to do maybe in the next half an hour or so is to actually give you a flair of what COVID-19 in children is like, and take questions at the end, of whatever you might have with regards to COVID-19 affecting children. I've sort of kept it as least, science intense as possible. But if there is
Seems to have lost the network.
I think we've got disconnected. Biji Babi, can you?
In the meantime, that Dr. Winsley Rose joins back, I would like to tell the audience, especially the children, you must have had so many thoughts and queries about different forms in which COVID has been affecting people, isn't it? So if you have a question in particular, which you would like to ask Dr. Winsley, listen to his session very carefully, and maybe you can put up the question in the chat box, and I'll pick it up from there and ask you to maybe ask the question at the end of it. Okay?
Yeah, he's back.
Yeah, he's back.
Well, I guess that's our first technical glitch. Tell me when the screen becomes visible.
No, the screen share is started, sir, but you'll have to select the right window. Yeah. Yeah, correct.
Is that visible?
Yeah, it's visible, sir.
Okay. So yeah, so I'm going to just talk about COVID-19 and children, and without much more. So the outline of my talk today is actually going to be like this. So it's basically addressing children. So can children get COVID-19? And if a child can get COVID-19, then how does the child know that the child has COVID-19? And what will happen to them if once they develop COVID-19? And if they do get it, like how do they prevent the infection from spreading it to their parents and grandparents? Because as we all have recognized that it's often the older people who are at a higher risk of developing severe disease. So, I mean, children, even though they might get infected, they might become a reservoir where they can actually transmit it to their loved ones at home and making them sick. So how do they protect their loved ones at home? And finally, we'll talk a little bit about how does one protect oneself from getting COVID-19. So that's the outline of my talk. So can a child get COVID-19? So this is actually data from yesterday. So if you look at the number of cases that have been reported from India, the total number of cases is over 3 crores. Now, if you look at the population of India, that's about 136 crores. And so, which means so far, from what is reported, we have more than 2% of the population which has been infected or affected with COVID-19. Now, of this, a certain proportion is children. We'll come to what that proportion is with children. So one thing is very clear, that really nobody is exempt from getting infected by COVID-19 because a large proportion of the population has got infected. I mean, what is shown here is only that which is actually tested and we know as cases. And for every one case that is reported, we know that there may be 20 cases which are not reported. And even in places like Kerala, where there is good reporting which happens, for every case reported, about 5 to 6 cases go unreported. So anybody can get COVID-19. That's the point. Now, if you look at the distribution of children and adults getting COVID-19, in this graph, I've tried to show you, out of 100 people getting infected, what is the age distribution of those who get infected. So you can see that as the age increases, the risk of people getting infected also increases. And it is only a small proportion of children that get infected. But what I want you to remember is that it's not that children cannot get infected. Children do get infected, even if it only means 0.5%. When you actually look at it on a large scale, in the national scale, and the proportion of children in that particular age group, it is a large number. So children do get infected with COVID-19. So if we need to actually figure out a little more about COVID-19, we need to know a little bit about what causes it, and then we'll figure out how to prevent yourself or your loved ones from getting COVID-19. So there have been many webinars, news articles, WhatsApp forwards, all sorts of things which have actually educated people, some right and some wrong. So I thought I'll just, anyway, for the sake of being on the same page, I will also give you a short summary of what COVID-19 is also about. So it is caused by the SARS-CoV-2 virus. I mean, for those of you who are science students, so it basically refers to the severe acute respiratory syndrome, coronavirus 2. That's the sort of the expansion for SARS-CoV-2. And the disease that SARS-CoV-2 virus causes is the coronavirus disease 19, because it was identified in 2019. So coronavirus, that's the COVID-19. Now, coronaviruses are a group of viruses which have been there over the over the past thousands of years. Now, these viruses, out of the so many coronaviruses that are there, we have about 7 viruses which actually cause disease in humans, of which only 3 viruses actually cause severe disease. Now, we know about, normally we get cold and cough. No, I mean, I'm sure all of you recognize that, maybe 2 or 3 times a year, people just develop cold and cough. And a lot of those colds and coughs are actually because of coronaviruses. And those viruses are the ones which are here. That's the NL63, 229E, OC43, and HKU1. So, I mean, don't worry about what they are. Just to tell you that there are these coronaviruses which have always been with us, causing common illnesses. But of late, we've had these 3 severe disease-causing coronaviruses. The first one was in 2003, which was the SARS, which was maybe now we can call it SARS-1. Then in 2012, in the Middle East, in Saudi Arabia, we had the MERS coronavirus, which is Middle Eastern Respiratory Syndrome virus, which again caused very severe disease. And now we have the SARS-CoV-2, which we sort of identified in 2020, but the disease itself started in 2019. Now, of these 3, like the SARS, MERS, and SARS-CoV-2, SARS-CoV-2 is actually the mildest of the lot. But the difference between SARS-CoV-2 and the other 2 severe illnesses is that the SARS-CoV-2 spread like wildfire. So it spread to a lot of people, whereas MERS and SARS were actually contained within smaller populations. So only small populations got involved, but among those who got involved, more people died. Whereas SARS-CoV-2, large parts of the population have got involved, and a small proportion have died because of the SARS-CoV-2 virus. Now, why is it called coronavirus? I mean, this is a nice cartoon which actually shows you the crown-like thing. So that is why it's called, it's like a crown-like virus, so the coronavirus. Now, these viruses, how do they spread from one person to another? It is important for us to recognize how they spread, because once we know how they spread, then we can take precautions as to how to prevent that spread. So the theme of my talk today is actually for you to recognize what are those important aspects of your life where you may come into contact with coronavirus, and how you can prevent yourself from developing coronavirus. So for that, if you have to figure out how it spreads from one person to another, there are 3 modes by which it spreads from person to person. First, it's the droplet nuclei. Now, droplet nuclei, like let's say, I told you it causes like a common cough or cold, and these are small. Whenever you breathe or sneeze or whatever, the small particles on your nose and mouth, they can actually come out. Every time you speak, you might be spewing out a few particles of saliva and secretions from your mouth and nose. So along with that, these viruses also actually get onto the air, and they can travel a bit. And if somebody else comes into contact, breathes the same air, then these viruses can go into their nose or mouth and then settle there and develop an infection. The next, that is called airborne droplet nuclei, which basically means it gets the droplet nuclei becomes airborne. They sort of dissipate in the air, and they can go to a further distance. Now, if you sit inside a closed room where these droplet nuclei are actually circulating, if you do not take appropriate precautions, you are at risk. So, like a crowded bus or within a classroom, or a marriage hall. These are all closed spaces. So if you sit there and if somebody who's got coronavirus is spewing out these particles, then you can get the coronavirus. Now, next is droplets. Droplets are little larger particles. I mean, you can imagine when you sneeze or cough, there are these larger particles which come out of your mouth and nose. So these particles, if somebody comes into direct contact, that if you're within 1 meter distance from another person who has, if you're within 1 meter distance from another person, and that person is coughing or sneezing, it is likely that that particle can get into your nose or mouth, and then you can develop the infection. The next mode is contamination of surfaces. Let's say I'm sitting here and coughing, something falls on the table here, somebody else comes, touches that, and then takes it to their mouth or nose, then they can get infected. So now, when we think about preventing spread from one person to the other, we should actually remember that these three things are at play. So we should, and now we know very well that there is good, we know, how to prevent these kinds of transmission, whether it be airborne, whether it be droplets, or whether it be contact. So how can you prevent airborne transmission? Now, airborne transmission, I told you, it's small particles, and the further you are away from the person who is infected, the less likely you will acquire the disease. So which means if you make sure that if you at least keep a distance of about 2 meters from another person, then your risk is less. Now, I'm not saying there is no risk, your risk is lessened. Now, how do you prevent somebody who's spewing droplets from giving you coronavirus? The best thing is actually to wear a mask. So the person who's coughing should wear a mask, coughing or speaking, or the person who's infected should wear a mask, and the person who's not infected also should wear a mask. In that way, you can actually prevent the spread through droplets. Thirdly, you have to, if it's by contact, like if I were to cough and the particle is resting on this table, if you touch the table and before you take it to your nose or mouth, you wash your hands, then you can actually prevent that mode of transmission as well. So there are these three things which you can do to prevent the different modes of transmission. That is, you watch your distance, wear a mask, and wash your hands with soap and water or with an alcohol hand rub as frequently as possible. And we'll come to what are those instances when you need to do this. Now, there are some other things you need to realize. Somebody might think, oh, I'm sitting here with a group of healthy people, nobody is sick, then why should I take all these precautions? So when can somebody spread coronavirus if they've got the virus? So I thought this graph actually shows you how it is. Before you become sick, even about 2 days before you become, if one with COVID-19 becomes sick, they can actually become contagious, which means they can actually start spreading the virus about 2 days before they even become sick. Not only that, not only can they spread the virus before being sick, there are some people who may never feel sick and still can spread the virus. So that is why it is important that it's not just to recognize and avoid people, only those who are sick, but it is actually, when I say using mask or wash hands or distancing, it is at all times, because you do not know who's that one person who is actually harboring the virus. And right now, since the virus is there as a pandemic, it's there everywhere. If you do not take appropriate precautions, it is very likely that somebody will get infected as well. In your own families, I'm sure a lot of you would have at least known someone who's actually been affected with coronavirus. And you might even have families where somebody has become very sick or even died because of the disease. So it's not something to be taken lightly. So how does, like, let's say you've taken whatever precautions, I mean, in spite of all that, you could still develop the disease. So how do I know when somebody has COVID-19? So I told you, you could be asymptomatic. Now, you all recognize a pyramid. So the bulk of the pyramid is the base. And in coronavirus disease, the bulk of the patient, the bulk of the people who get infected either do not have any symptoms or they have very mild symptoms. So 80% actually don't have any symptoms. And even if they do have, they have very mild symptoms. They might have some mild fever, some little bit of runny nose, some cough, and then it goes away. And it's the rest, which is about 20%, which actually require any medical attention. And some of them may require oxygen. And a small proportion, about 5% of them, might require critical care, ICU care, and they are at a risk of dying. And about 1 to 2% actually die of the disease. So important to remember, you could have mild symptoms or be asymptomatic and still have COVID-19. So the bottom line is, you really can't look at a person and say that person does not have COVID-19. So I could be sitting here and I'm talking to you and looking fairly healthy, but I could be harboring COVID-19. You never know. And you may, or even if you have the disease, you may or may not develop symptoms. So that's the key thing. So if you were to develop symptoms, what are those symptoms? Now, in children, the common symptoms are like this. You can have a fever, you can have cough, you can have shortness of breath or breathlessness on walking or climbing stairs. You could be fatigued. Some people complain of sore throat, loss of taste and smell. I mean, a lot of people recognize that as an important symptom of COVID-19. Or you can have muscle pains, aches, pains, or runny nose. A lot of children actually have diarrhea and abdominal pain. Now, I must say, in children, for maybe one to two in 100,000 children develop something which is actually a little more serious than this kind of an illness, which is called MISC, or multi-inflammatory syndrome in children, which is actually a serious disease. That usually happens after somebody has been infected with COVID-19. Maybe about 2 to 3 weeks after they've been infected, they develop this very serious disease. There again, they present with fever. So so if you develop symptoms, then how do you know that somebody has got COVID-19? So for that, you cannot look at somebody and say, okay, they may or may not have COVID-19. There may be other illnesses which look like COVID-19. So you can't say by the looks of a person or by examining them. So the best way to figure that out is actually do a test. Now, there are 3 types of tests which are available. And 2 of these tests are done by using a nasal swab, or, as it's shown in this picture, somebody sort of sticks a little cotton-tipped stick into the nose, and that is sent for testing. Sometimes it can also be taken from the throat. So there are 2 tests which are done, of which the molecular test, which, for those who are science students, you probably recognize that, the virus actually has some genetic material, it's an RNA virus, so it's RNA. And it is that RNA which is actually picked up on this particular technique, by a particular technique called polymerase chain reaction, or PCR. So if you do a PCR and pick up PCR which is specific for, pick up genetic material which is specific for SARS-CoV-2, then you know you've got COVID-19. Now, that's the most sensitive test. There's another test which is also used in fairly frequently, which is called the antigen test, which basically the molecular test looks at the genetic material, whereas this antigen test looks at the amount of protein. The protein which is there in the SARS-CoV-2, that is actually picked up by this particular test. And this test also, again, it is done by either a nasal or a throat swab. Now, remember, both these tests actually tell you that you either have current infection or you've just recovered from an infection. So, whereas blood tests which are done, which are called serological tests, actually look at antibodies. Now, antibodies are something which the body produces. Like our own body produces, like when you get COVID-19, our body produces antibodies to fight against the COVID-19. And these antibodies stay for a long time, even after the disease is gone. So if you look for antibodies and you find it to be positive, it often reflects that you had an infection in the past and doesn't mean that you have a current infection. So 3 tests. The test which will tell you whether you have disease now or not is either the molecular test or the antigen test, the PCR test or the antigen test. Now, if the antigen test is not so good. So if it is negative, it's often better to actually do a PCR to determine whether you're actually infected or not. Now, I know this may be complicated for you. I just put it up to just show you. I'll just take you through this slide. So this is the timeline. Day 0 is when somebody develops symptoms. Day 0 minus 5, that is minus 5 to 0. This is the period when somebody does not have symptoms but has the virus. Now, this green, which is here, the green line actually shows you the amount of virus there is. Now, can you make out that even before day 0, the amount of virus is actually going up higher and higher. And by the time it is day 7 or day 8, it actually has come down significantly. Now, the blue line actually shows you when you have mild or moderate illness. And it's after about 6 or 7 days is when you can have severe illness. And after about 10, 12 days is when you develop critical illness. So, I mean, this is just to tell you that even before you start your symptoms, your viral load is high, which means you can transmit it to other people even before you start the symptoms of COVID-19. So what will happen to you if you were to actually develop COVID-19? What will happen to you? Now, so the best way to determine, if you actually have symptoms, it is best to go to the doctor. Because like I told you, you cannot determine for yourself whether you've got COVID-19 or not. You need tests to be done. And COVID-19, the large majority of people don't develop anything very significant, but there is a small minority which can develop severe, serious illness. So once you get to the doctor, what does the doctor do? He checks you out to check whether you've got illness which is mild or moderate or severe. Now, the things that we look at and say, okay, now these are danger signs for attention that you need to actually immediately get you into hospital. No, so we look for those signs. So what are those signs? Like if you just have a cough, cold, runny nose, fever, little bit of abdominal pain or diarrhea, it's okay. But if you develop fast breathing, or if you have difficulty in breathing, or if you have, your skin color changes, if you're not able to drink and you've been persistently vomiting, if you become irritable, like, some children come with inconsolable cry, they're very lethargic, they do not interact with you when you talk to them, or sometimes they may even have seizures, convulsions, or they may be excessively sleepy. So if any of these danger signs are there, then you would get admitted. And the team of like the healthcare providers will actually determine what course of treatment you need and would treat you accordingly. But if you do not have any of those, and if you just have some mild symptoms, you may be just sent home. Like I told you, bulk of you, the 80% of people who develop the disease do not have any severe symptoms and will be sent home and to take care of yourselves at home. So then comes a little bit of a complication, because you're sitting at home, you have parents, you have grandparents who are at home. Now you need to figure out how to keep yourself healthy and to keep your loved ones at home safe. So we actually have a home isolation protocol. So some of the important things to think about are, if you have somebody who's sick with COVID, it's better to just keep them in a single room and with their own separate toilet. and everybody else stays away from that room. And the person who's affected, I mean, it's better if it's a well ventilated room. I told you about the airborne droplets which are there. You don't want that droplets to be piling on inside your room, so that when your mom or dad who come and check in on you, you don't want to give it to them. So it's better to be inside a well ventilated room, and you stay away from others, and all the time wearing a mask inside that room. And for your the other members of the family also to wear a mask during the time that you are sick. So then you should actually keep yourself. I mean, we have a home monitoring program where we actually check the person's temperature, check their respiratory rate, ask the parents if they've got any breathing difficulty. If anything like that develops, then you should seek medical attention immediately. You should go to the doctor immediately. Otherwise, it's fairly, you just have good food, take rest in a well-ventilated single room with its own toilet. That's all that is required. Now, if you do get, how do you prevent others from getting it? So the three key things are, as I mentioned earlier, wear a mask, wash your hands with soap, and watch your distance. Now, why should someone wear a mask? Does it matter? Why should you wear a mask? Now, this cartoon here shows you fairly clearly why somebody should wear a mask. Now, the top picture, the top two people, the girl in glasses and the guy, both do not wear masks, and one of them is infected. One person spreading it to the next person, the probability, the chance is about 90%. Now, the second, in the second row, the girl is wearing a mask, and the guy is not wearing a mask, but he is the one who's infected. So if you are infected and if you do not wear a mask, but there is somebody else who is wearing a mask and is not infected, still the chance of that person getting infected is about 70%. It is still quite high. Whereas if you are infected and if you wear a mask, then your risk of transmitting even to somebody who does not wear a mask is only 5%. So wearing a mask is actually not to protect yourself as much as to protect the other people. Now, there is also a transmission probability which comes down to 1.5% if both people wear masks. So I think it's very clear that wearing masks prevents transmission. More so if the person who's infected or affected wears the mask. So what mask should you wear? Now, cloth masks are okay if you're healthy. If you do not have any symptoms, that's fine. But if you have COVID symptoms, or if you're a healthcare worker, like I do wear a surgical mask in the hospital where I work, or if you care for someone with COVID in your home, or if you're over 60 or you have any underlying diseases, then you should wear a medical mask or a surgical mask. Both refer to the same thing. I've shown a picture here. A lot of people actually, you can see walking around with N95 masks. N95 masks are actually more for specialized situations within hospitals. It is not required for public use. I do not wear a N95 mask when I see patients in my outpatient. So I wear a medical or a surgical mask. So these are the situations in which you wear these kind of masks. Now, when should you wear a mask? Like, should you wear a mask the moment you wake up from bed, or do you wear it during sleep? So you should basically wear a mask when you're indoors with other people. Now, when you're indoors with other people, regardless of distance, you should wear a mask. I told you why, because of the small droplets. Otherwise, if you're, let's say, outdoors, and if you cannot maintain a distance of about 6 feet or 2 meters between two people, then you should wear a mask. So if you go to even if you're walking around in the road, and if you're not in, it's very difficult to maintain 6 feet on either side of you if you're walking on the road. So it's probably a good thing to wear a mask. Now, do you wear a mask during sleep? No. Do you wear a mask within your own home with your family? Not necessary unless somebody is symptomatic or unless somebody is sick. Now, children less than 2 years, maybe it's not a good idea to wear a mask, because they cannot manage a mask, and also it may interfere with their breathing. 2 to 5 years, children can wear a mask with supervision. 5 to 11 years, they should wear a mask in all situations where adults wear a mask with supervision. And anybody who's over 12 can wear a mask like adults do in all the situations where adults are required to wear a mask. Next, washing hands. Now, I told you about the particle which sits on the table where you cough or sneeze and then you touch it and then take it to your nose. So that's what you're trying to prevent by washing hands. So what would you use to wash hands? You can use an alcohol hand sanitizer, which should have at least 60% alcohol. Or you can hand wash with soap. Basically, you wet your hands, you lather, you scrub, you rinse, and then you dry. This whole process should take at least 40 seconds. Now, I think when all should you wash hands? After using the bathroom, before eating, after touching pets, after playing outside, after coughing, after sneezing, or blowing your nose, after you handle your mask, before and after you wear a mask. So these are all situations where you will want to wash your hands. There is no, it's nothing. The more often you do, the better it is. Now, what I want to actually tell all the adults in this group, children will never listen to what you say, but they will do what you do. So I think it's important for us to actually show the way to the children. So we must wash hands, wear masks, maintain distance, if we want our children to follow what we want them to follow. So I think that's the key message. Adults should follow all this for the children to follow as well. Now, distancing. Now, with regards to distancing, you're children. You need a social life. You need to play. There are things that you might want to do. So you have to be prudent as to what you do. So when I say distance, there are 3 things that you need to keep in mind. One is location. Now, is this location within a room or is it outdoors? Outdoors, your risk of getting it is very less. And now outdoors, if you actually play outdoor games, maybe football or basketball or something like that, or even badminton. You play badminton, you don't come close to 6 feet while playing. So it may be okay if you're playing outdoors to not wear a mask and play outdoors. But if you think you're going to have a distance of less than 6 feet between 2 people, then you must wear a mask even if you play outdoors. But indoors is a different ball game altogether, because indoors your risk of actually transmit is much higher. So it is always better to, even if you play some game within the house, it is always better to wear a mask. The next thing is proximity. I told you, the closer you are, the more risk there is. The further away you get from each other, the more safe you are. So the ballpark figure is 6 feet, but it's not a given. The next thing is time that you spend. Is it just saying hi and hello and you walk away? Or are you going to sit and have a chit chat over a cup of coffee for maybe half an hour? So that matters as well. So be prudent when you think about distancing. Just think about what your risk is when you're interacting with an other person. Now, finally, we talked about mask, distance, and hand wash. Finally, I'll end with the use of vaccines. Unfortunately, we don't have a vaccine that is approved for use in children in India yet. It's coming. Till that point, the only people that can be vaccinated are the adults. So what I want to impress upon you, this is probably a little technical slide. I'll try and see how I can explain the slide and make it as non-technical as possible. Now, this is a study which we did in CMC Vellore. Now, CMC Vellore, it's some of you may know or may not know, it's a large institution. We employ over 10,000 people. Now, out of these 10,000 people, everybody was offered the vaccine. Everybody was told, you must go and get the vaccine. Now, like everywhere, Some people got, some people didn't get, some people got one dose, didn't get the second dose. So what our administration very cleverly did was to actually follow up all those people who got all the vaccines, got one dose of the vaccine, and got no vaccine, and then saw what happened to them. Now, this is actually published in one of the journals, and I'm going to just show you some of the results. So the ones who were not vaccinated, that is what I've highlighted in red, there were 1,600 people who were not vaccinated, out of which 27%, that is 438 people, developed the infection, of which 64 were hospitalized. 11 of them required oxygen therapy. 8 of them required ICU care, and 1 person died. This is among the ones who were not vaccinated. Now, the one in brackets is actually the percentage. So you can compare percentages. Then we looked at who received one dose. About 1,870 people received one dose, of which 10%. Compare this with the 27% here. 10% only developed infection. 1.2% only got hospitalized. Nobody required oxygen. Nobody required ICU care. Nobody died. Then look at the ones who are fully vaccinated. That these people got 2 doses of the vaccine. About 10% got infected. Even lesser percent than the ones who received one dose. That is 9.9% got hospitalized. 4 of them, 4 out of 7,000 needed oxygen. Compare that with 11 out of 1,600. 2 of them required ICU care and nobody died. So the point is, if you take the vaccine, your risk of death is very, very low. And also, if you don't take the vaccine, if 1/4 get infected, it's only 10% which will get infected if you get fully vaccinated, which also means that you will actually prevent spreading from to other people, including your own family members, including your children. So for now, what we can do is for the adults to get vaccinated. Now, next, the question comes, which vaccine would you use? There are so many vaccines available. There is Covaxin, there is Covishield, Sputnik is also available in the market now. Moderna, which may not be available yet in the market, but it's approved for use. So there are these 4 vaccines available. Like Anthony Fauci, the person in the medical advisor to the United States says, the best vaccine for you is the one which is available to you right now. Don't really worry about what vaccine, whether how good it is and all that. I mean, all those have been done. We know that they are all effective. So you just take whatever vaccine is available for you, closest to you. So vaccination is very important. Protect yourself and protect those around you with vaccines. Now, at the start, like I told you, I don't have experience with teaching children. So I talk to them one-on-one when they come to my outpatient clinic. So I asked my daughter, who is in grade 12. So I asked her, I'm going to give this talk to children and their teachers. What would you like to know? She had only one question. When will schools reopen? I bet that's the question which all of you have as well. Now, to answer that, I do not have a good answer because that's a political decision. Now, it's the bureaucracy and the politicians who will actually decide when schools will reopen. What I want to tell you is what to do when schools reopen. When schools do reopen, we will still be at a risk of developing disease. Now, this is a group of children who are actually sitting and studying with all of them wearing masks. Now, even when schools reopen, remember, wear a mask, wash your hands with soap, watch your distance, and finally, everybody who's in the school, as soon as the vaccination is available for that particular age group, get vaccinated. All teachers, all school workers, everybody should get vaccinated if you want to keep your children safe and healthy. So with that, I'll stop. Maybe time for some Corona bondas and these Baroda masks. So I'll stop sharing if there are any questions, I'm happy to take.
I'm sure all of you would agree that it's been a year since we have been living with this new disease, and we've been listening to so many people speak to us and listen to so many versions on the television. But I'm very sure that everybody in this webinar would have surely been benefited by all those scientific facts that you put forth. And basically, those graphic representations were so easy to relate to that I'm very sure even the children in this group would have surely understood why and how we need to be careful with this particular disease. Thank you so much, Dr. Winsley, for presenting and making it so easy to understand all the nuances related with this disease. Now, I would request the teachers or the students and parents, those of you who would like to put up questions to Dr. Winsley, if you can put up the questions in the chat box, I could read it out for you. Or is there anybody who would like to ask a question? You can raise your hand. Okay, there's a question.
Maybe there is a question which says, how should Sunday schools and churches be prepared
I just saw
when
it. Thank you.
take place? So let me just try and answer that. So I think Sunday schools and churches, it's similar to schools. So basically, you still have to maintain distance, make sure that the classrooms are well ventilated, the churches are, the doors are open, windows are open. It's better. I mean, even if you have the AC on, it's okay to have the AC on and have the windows and doors open if you have AC churches. So because like I said, like these droplets, if they are in a closed space, your risk of transmission is very high. You might have known people who've gone for funerals and, or marriage functions and get infected. It's not because that it's the dead person who's actually transmitting the virus. It is the people who are attending the funeral who are infected, who are transmitting the virus. So often we should be very mindful of these things. Now, somebody has asked, what are the first aids to keep? Now, see, like so far, we've had about 1,000 children who've whom we've diagnosed with COVID in CMC. Now, it is no different from treating any other viral infection, for starters. So first aid, there is nothing which is going to happen in such a hurry that you need to give first aid for a child. A child might have fever, for which paracetamol is sufficient. They might have some cough, some runny nose, which I don't think you need to actually, you may or may not require treatment for that. So the best thing is to just give paracetamol, keep them hydrated, and good food. And nothing is going to happen in such great, urgency at church or at Sunday school that you will have to. It's not an emergency. If somebody were to become sick, they will become sick slowly over a few days rather than few hours or few minutes. At least, I'm talking about children.
There's a question from Pauline Johnson, who's asking from which age group can we allow children to go to Sunday school during this COVID situation?
So, masks, less than 5-year-olds, it is difficult for them to actually handle a mask. So I would suggest if you have somebody who's over 5 who can wear a mask all the time under supervision, that may be okay. And if you space them out and maybe have Sunday classes outdoors, that may be a good thing to do. Less than 5, I would say not.
Bharti Hanstak had raised her hand. Bharti, can you unmute and ask your question? Or maybe Rita, you can unmute her. Bharti Hanstak.
Oh. Actually, I had the same question what Reverend Jyoti asked. So I got my answer. Thank you.
Is there anybody else who would want to ask a question? I think no more.
Are there any children who want to ask any questions? So there is a question which is said, there is a question in the chat box, where they've asked whether the proportion of children being affected is less because children go out less. Actually, if you look at the second wave, a lot of people who got infected in their homes. I mean, it is possible, the adults got infected mainly, but then when the adults came back to their own homes, they gave it to the children. So it is possible that the proportion of children getting infected is less because of their lesser interaction with other children and all. It is possible. Also, even accounting for all that, children actually are infected less compared to some other diseases like influenza. Somebody has asked, is it safe to actually undergo a nasal swab for somebody who's had surgery for adenoid glands? It's okay. I mean, there is no problem with you getting a nasal swab done. And it doesn't, the adenoid actually sits right back inside your nose, and they don't go that far deep in also. And it's not a problem.
There's another question coming up from Reverend J. Williams asking, what are the precautions that can be taken for children below the age of 5?
So, like I said, I mean, if you can use a mask, then try and use a mask. If you can't use a mask, I mean, it is to actually keep them away from people. That's the only thing that you can do, not take them into crowded places. So those are the things that we can do. We can't, mask becomes less of a thing than otherwise. Remember, I mean, I told you, see, small children are always in contact with adults. It's not like small children take care of other small children. So if the adults are vaccinated, you can actually protect your child. So vaccination finally is the real answer to this whole problem. So till vaccines come for children, I think it's important for everybody to take the vaccine, even for the sake of protecting your child.
There's another question which is asking for, is it safe to go for a nasal swab if the child had an adenoid glands operation 2 years
back? I just responded to that. Yeah, I said it was okay.
Sorry. I missed it.
Yeah.
I think that's...
So then there was this question on attending online classes on mobile and laptops. I think maybe it will be dealt with in the next session. So I'm not going to deal with that.
I think we can take this last one question. It says the third wave will affect the children more. Is this true?
So we actually looked at the difference between first wave and second wave. We found actually the second wave, even though more children were infected, the proportion was about the same. So we don't believe that third wave will be any different. If there is a third wave and with many people get infected, more children will get infected. But we don't think the children will get disproportionately infected or disproportionately become sick because of because there is going to be a third wave.
Thank you, Dr. Winsley Rose, for all those insights and the answers to those questions. You explained it so very well. Okay.
Thank you.
There are some more questions. Do we have the time?
I think maybe I'll just the EcoSprint, whether you should stop before taking the vaccine. We don't stop EcoSprint in our own institution for somebody who takes the vaccine. So it's okay. And corona does damage the lungs if you develop severe disease. So you should meet your doctor for that if you developed corona and you had severe disease.
Matthew, can you help me with the person who's raised the hand? I cannot locate them on the screen.
Yeah, sure. Let me just see. Somebody had raised a hand to ask a question.
It's okay. Bijwabi, let's take the question. We can move on to the next session. We can answer
next session.
Let the questions come in, not a problem.
Okay.
Okay. Thank you.
Thank you, Dr. Winsley Rose, once again. Even as the COVID-19 pandemic is spreading its tentacles all into our societies and our lives, many of us still have a mixed feeling, and many of us are still asking questions as to where is God in all this pandemic? And why would God allow all this to happen to his people? But experience and the path that people have taken during the course of the pandemic have helped them to understand the love and grace of God in more than one ways. We have the privilege of one such family who shared their testimony with us and which will be put up in a video presentation now for all of you. Can we have the video? Yeah.
Many children and teenagers are feeling isolated this year, especially now that the holidays are upon us. Remote learning and social distancing have drastically reduced the quality of life for millions of kids across the U.S. because of the pandemic. The CDC has reported mental health.
India is still battling a devastating second wave of the pandemic. Children may be among the least likely to be killed by COVID-19, but they suffer in other ways, especially when their own parents die from the disease.
Since the coronavirus disease 2019 pandemic was announced, we had an unprecedented change in the way we organize ourselves socially and in our daily routine. Children and adolescents were also greatly impacted by the abrupt withdrawal from school, social life, and outdoor activities.
To me, COVID is a huge killer, and it's just an awful thing.
COVID is very stressful and very sad.
I love to social gather, I love to travel, but we can't do that in COVID.
We cannot go out anywhere, and we cannot have like birthday parties.
Some of them also experienced domestic violence growing. The stress they are subjected to directly impacts their mental health on account of increased anxiety, changes in their diets, and in school dynamics.
I want to go to normal school, but I'm just scared about dying. I get nightmares in the nighttime.
We at ISA tried to reach out to children whose families were affected with COVID to understand what they have gone through. Many were hesitant to share their journey on camera, but one family came forward and agreed to share their experience. This is the story of Joanne and Ruben, 16-year-old twin children of Salmon Jacob and Premna Jacob.
It was 18th of April 2021 when my dad started getting feverish. We just had shifted to our new house the previous day. We somehow realized that my father was suffering from COVID. 2 days later, my mother also started showing COVID symptoms. Both of them were under medication as advised by the doctor. But after a few days, we saw that my father's oxygen level was started going down, and the doctor asked him to get to the hospital as soon as possible. And getting a bed during that time was so difficult, as the hospitals were flooded with COVID patients and there were no beds available.
By God's grace, my father was able to get a bed in a good hospital. But the very next day, even my mother's oxygen level dipped, so she too had to be rushed to the hospital. Now, me and my sister were all alone at home, and we had to manage all our things on our own. There was fear, uncertainty, and a sense of vacuum on us. But we knew that God's grace and mercy was with us. Just a week before all of this happened, a community kitchen started near our colony, which provided free food to the COVID-affected families. So my father contacted them and asked them to supply food to us because my mom wasn't able to cook any food due to her weakness. Seldom did we realize that after just this week, my father and my mother could get admitted in the hospital. So we had to survive with this food. We believe that this is God's provision.
In the meantime, I also started showing COVID symptoms. My dad's friends and colleagues arranged medicines for me. There was fear as we were alone, unwell, and in a new place and surrounded by unknown people. Our grandparents and relatives from Kerala, my dad's friends and colleagues used to call over phone, inquire about us and motivate us. Both Mummy and Papa had taught us to always depend on God and that God hears our prayers, loves us and cares for us. So we used to read the Bible and spend time praying to God.
The circumstances were not good at all, as we were hearing a lot of people dying in our colony on daily basis. But we had faith in our God, and so He gave us strength and confidence to fight it. After 10 days, my father got discharged from the hospital, which was a great relief to us. God has been gracious and merciful to us. My mother took 24 long days to get discharged. We were very happy to see her return.
As we look back, we are grateful to God as He led us, provided for us, and strengthened us in the midst of crisis. We give all glory to God.
We wish to thank Salmon Jacob and his family for all the efforts they took for this amazing testimony. It's all taken an unthinkable toll on children. A social, emotional, and academic ordeal so extreme that some advocates and experts warn its repercussion could rival those of a tsunami or other disaster. A nation of children coping with trauma, illness and disruption will need more than a vaccine to address the fallout.
Just as the kids in the video said that their faith helped them to glide through the crisis situations. I think that's a beautiful message from that family for all of us who are in this webinar. Faith that can help us face all uncertainties, fear, and all the things that have disturbed us during this pandemic. The scripture brings forth a beautiful message of being not afraid because God is with us. I think we all need to strengthen our faith during this time of pandemic and help ourselves lead through such kind of uncertainties. Now, just as the pandemic has been taken up in different with the different perspectives in this particular webinar, the next thing that we're going to have is also a very interesting session. The pandemic, it's been almost a year that we've been living with this pandemic, and there are so many new things that we get to learn on a daily basis. First, it was the vocabulary that was going on increasing with words like quarantine, which children found very difficult to pronounce and then to spell it. Then we had social isolation and also self-distancing. Now, all of these words and many more, lockdowns and travel bans and so many more of them. So with all of these things coming up, children were put into a shell where they could feel getting suffocated because of the terms that they would be hearing, because of the boundaries of their houses where they were restricted, the movements being restricted and not being able to meet their friends. They would still be so nostalgic about those times when they could move out of their houses and be friendly with their classmates, mingle around with them, play on the grounds, and so on. It's not only in children, but also, of course, the elders who have been suffering different forms of mental health issues. This is the first time, I think, in world history where mental health has been approached and given a better outlook rather than what it was being done in the previous times. In the pre-pandemic times, mental health was such a taboo that even now people fear talking about those issues. So when we have anxiety, loneliness, sadness, fearfulness, all of these drenched into the situation of pandemic, we need someone who can guide us through these situations, help us equip ourselves better. And we at ISA could not think of a more a better resource person than Miss Reena John. Let me take this privilege to introduce her to all of you. She is the principal of St. Thomas High School, Secunderabad. Besides being a certified counselor, she is also an NLP practitioner practicing individual and family counseling. With her wide-ranging experience of national and international level of teaching, I think we could not have asked for a better resource person than her. She is presently the member of Secunderabad Bethel Marthoma Church. Reena Kuchama, it's over to you now.
Praise be to God Almighty for giving us this opportunity to be together. And thanks to technology that has made this possible for people across the country to come together and listen to so many resources that we are having around us so that we can fight this pandemic together. As the video concluded, it requires more than the vaccine to fight this pandemic out. And we just had a wonderful session by a doctor who gave us a detailed understanding of do's and don'ts as children and as adults. I would like to share the screen now. Let me also appreciate the organizations ISA and NCCI for doing this webinar, arranging this webinar, and doing a Christian responsibility when the world is going through so much of pain and suffering around us. Yes, definitely, this is the time that we were created for, probably, and this is what the role that we have to play in the situation like this. Also happy to see Aib Joseph-Achan and Kochama and all my old friends whom I have been associated for long years of our ministry life. Today, the topic is the pandemic emotional effects on children and how can parents and teachers help these children. So when we talk about the pandemic, as Biji said, who's junior to me in my college, it has not only affected the older generation, but yes, definitely a lot the younger generation as well. I have been into this counseling field for the past 15 years. And I would say definitely in the last 1.5 years that I have come across, the cases are very different from what I handled in the previous years. And this session is basically focusing on how are we going to address this together. I talk to so many adults, young couples, middle-aged people who are going through these emotional challenges during this time. But I always redirect them by one thing, making them realize how much more difficult it is for the children. Because at least we at this age have things to look back, cherish the memories, the places we have traveled, the things we have enjoyed, and still sustain us when all these are restricted. But right now, what we see is the little children who have just begun their life, who were supposed to go to the Montessori schools, classes, enjoy the interaction with their friends and do things with their hands. So all the motor skill activities, the mental creativity, all that has been affected. And so I would generally frame it, the physical, mental, and spiritual growth has definitely been stunted in the children. How has the pandemic affected the children? Yes, physically, where all the outdoor activities, going to the playground has been affected. Socially, so many birthday parties that our kids enjoyed, or just getting together as families, or just the fellowship of the prayer groups or the church community has been restricted. Spiritually, yes, the children enjoy the worship service when they were a part of the worship service? Yes and no. Everything of the liturgy they might not have understood. But I remember my childhood days when we went to church, and more than the liturgy and the worship, we just enjoyed pulling off frocks or, pulling off hair of the person who was standing in front of us during the worship service and looking at the rolling eyes of our elders. All that was a joy when we were a part of the corporate worship. Definitely, children always had the privilege of attending VBS, Sunday school camps, youth camps, and after every youth camp, the excitement and the fun that they had would keep them motivated or keep them charged for next 1 year, and they would look forward to come back to these camps again. But definitely all these has affected them so much. So what is the major effect? Emotional effect. Being in the educational field for the past 30 years, I have seen children of different age group. I have worked with school children, I have worked with university students. Presently, I am in charge of a school where you have students from class 1 to 10. And so different age group students, when I interact, what is the response I get from these children? Most of them going through a lot of anxiety. As doctor reminded us what is the biggest need of the child who is in 12th standard, doctor's daughter. She said, when will the school reopen? Definitely, every child has this question in mind. And the students who have been coming to me for their anxiety issues, the question is, ma'am, when will the school open? I always try to motivate them saying, at least because you don't have to go to school, you are free of the teacher's punishment, or even because you are attending the online classes, the teacher's scolding or the teacher's rolling of eyes, you can avoid by switching off the video or moving away from the screen. But that is not motivating them. Many of the children say, it would be good if we are just able to have a look at the playground because we miss it so much. And so the anxiety, the uncertainty, especially the students in the high school who had so many plans of higher studies at the UG level and the master's level, they had so many different plans, but all that seems to be totally restricted at this moment. Fear, what is going to happen to me? And especially when there is so much news about the third wave is going to affect the children more, where doctor just clarified with us in a much better way. So fear of, will I be affected as a child? What will happen if the schools reopen? What will happen when everything is back to normal? It is us children who are going to get affected more. Frustration of not being able to do things which they once enjoyed. Disappointment and grief, because many of the children or many of us have seen our loved ones going through the sickness. Many of our friends have lost their near and dear ones. Many of us have lost our family members. All this has totally created emotional fatigue, and most of us are left emotionally drained. Now, how it has affected younger children? It is for us as parents and also as teachers or adults who are involved in the life of younger children up to 12 years to notice these changes. But let me tell you right in the beginning that everything like what you see should not be taken as an emotional disturbance, as every chest pain is not the sign of a heart attack. Every individual has unique experience. Children do have a unique experience. But these are the general features when the children are going through this kind of an emotional upheaval. Up to 12 years, if your child is irritable, crying for simple reason, and when you ask the child what makes you cry or what is it that is bothering, the child is not able to pinpoint a certain reason, but just ends up in crying. That is one of the reasons that it shows that the child is emotionally disturbed. Many of the children are waking up at night, disturbed sleep. They are not able to sleep at night. It would be suddenly at the middle of the night, they wake up and they say, I saw a dream. What is the dream? Oh, this happened to mama or dada. So this kind of disturbed thoughts during the daytime, again, making them go through this kind of unpleasant thoughts or disturbing thoughts even at night, and not able to have a real sleep. That is one sign. Stomach upset. Many children are complaining about sudden stomach pain, and when they go and show to the doctor, or in spite of all the medication that they are taking, there has been no physiological issues. It's actually a stress that is coming out as bodily reaction. So stomach upset, where kids are throwing up, not able to eat food, or frequent use of the washroom is also the sign of the emotional disturbance that the children are going through. Many children are just holding on to the parents. Many of the parents are working from home. They want to be alone in their room as they are locked onto the computers or their laptop. But the children just feel insecure. They just want to hang around the parents most of the time, in spite of the other people available at home who are willing or ready to take care of these kids. These kids are getting more and more clingy. Or some children are just withdrawn. They are not interested in playing with their regular toys. They just sit in the corner and not able to express their feelings. Intense tantrums. Many of the parents are talking about how the child who was usually a pleasant child suddenly has started hitting the younger sibling, or biting, or outburst, which was not a usual feature of that child. So intense tantrums, extreme aggression and sadness, more anger, more sadness. These kind of variation in the emotional expression of the kids, at least up to 12 years, could be a sign of the emotional disturbance that your child or children are going through. Teens and adolescents, they are also having their own challenges, because obviously the younger ones up to 12 years probably may not have all the information that is available online about the pandemics. They're just getting in bits and pieces. But for teens and adolescents who are so exposed to every literature, wanted or unwanted, right or wrong, and when they are exposed to all these kind of information, it is creating a havoc in their minds. And you see many of them with mood swings. Yes, definitely mood swings is a typical feature of teens and adolescents. But this has been accelerated by the pandemic. Variation in moods. No interest in talking to anyone. They are just in behind the closed doors, not wanting to come out of the room, even for their family lunch or dinner. They want to eat their food within the four walls of their own room without seeing anyone. They are losing interest in activity. Like previously, if they enjoyed music, or previously if they enjoyed playing some instruments, or previously they enjoyed sketching, painting, all these kind of hobbies which they enjoyed doing now previously has also been affected. Definitely sleep issues has become a challenge for our teenagers. They are sleeping very late at night and then not able to get up in the morning, and so the day starts only after 12 noon. Even if they have online classes at 8:30, they are not prepared physically and mentally to attend these classes. Academic challenges. What are the academic challenges? Continuous use of screen time have made them experience the challenge of focus, concentration, and memory. Right now, when I am in charge of a school here, I also teach biology, which has been my subjects in my B.Ed days. So when I'm teaching the subject, what I see is the children, when they're reading the book or reading the paragraph from a textbook, they're just skimming through the lines because that has become a habit. And so many of the times, half of the word, they are not able to read it correctly. So somewhere that reading skill, thinking skill, all has been affected. And definitely writing, speed of writing has been affected. Another aspect that we see how teens and adolescents are affected is increase in the risky addictive behavior. Wanting to try out things has always been a feature of teens and adolescents. But right now, even when they are inside the four walls of the room, there has been a considerable increase in the tendency to try out the risky behavior. Sometimes it could be self-harm. Sometimes it would be wanting to figure out, things which is easily available at home, or trying to get it from outside, or including the online games, which is kind of aggressive and violent games. So these kind of increase in risky and addictive behavior is also on a high. Also, we see lack of personal grooming. Previously, our teenagers and adults who spend so much of time in front of the mirror, trying to settle or try the new hairstyle or wanting to do things differently, now they seem to be losing interest in even the basic grooming. Somehow they are not interested in doing that. And thoughts about suicide or self-harm and death. If these are the features that we are experiencing as teens and adolescents, or we as parents and adults around them are seeing these changes, definitely it is alarming. We can't just think that it is okay, a passing phase, or it is just because he is not going out anywhere, or it is just because, things have changed so much in the past 1.5 years, so it will go off after some time. No. As Biji reminded us, mental health has been on a much higher rise these days, but at the same time, we are also able to see it openly. How to address it also has been the change during the pandemic time. Now, how can parents and teachers help these children, whether it is below 12 years or above 12 years? When you see these kind of changes in your kids, this is something which we as parents, teachers, and also as children can do. Be involved in each other's life. Our parents have become, busier than before, especially those who are working from home. There has been no end time from work. Even the parents are struggling to maintain that kind of a balance in the home and the work-life balance. And it is very difficult to find time for each other. How can we prevent this emotional setback, or how can we help us children who are going through this kind of emotional crisis being involved in each other's life? As children, let us be involved in the life of parents. As parents, very important that we notice our children and not stalk them. What is the difference between noticing and stalking? In spite of the busy schedule of the work, whether you are working from home or you have to go in person to work at the workplace, important, keep observing the changes that you are seeing in your child. Most of the time, what do we want to do when the child goes to the washroom, or previously when the child was away out of the room or went to school? That is when we want to, actually look into the room and the bags and the cupboards for things or which we would want to notice. That is called as stalking. That does not create empathy for each other. That becomes more like a CBI interrogation, and that does not help in a parent-child relationship. Important, be involved. And how can you do it? Keep noticing, observe them. In spite of the busy schedule, keep noticing the changes that is happening to them. Because most of the time, what is happening, there are kids, teenagers who are brought to me for counseling. And the parents say, all this has happened in the past 2 weeks. Or all this has happened only after the COVID started. Or all this started when we were restricted to everything at home. But the child would tell me, no, it's not like that. It is now they have noticed it. I was having this feeling for the past 4 years. This situation actually aggravated. And that is where I wonder, how come the parents did not notice this change in the child's behavior or child's response and reaction in the day-to-day activities? My dear parents and children, be involved in each other's life. And that is one way we can empathize with each other. This pandemic, if something has to be at the priority, is empathy. Children empathizing with the parents, the way they are handling the responsibility, the financial crisis, only then we will be able to move, or at least shift our focus from self-centeredness to other-centeredness. And that is what we all need right now. So be involved in each other's life. Talk regularly. Before this pandemic, all of us were rushing through things. And most of us said that we do not even have time to spend with each other. But once the pandemic and the lockdown, everything started, we had ample of time. But what happened? The communication broke down. Seeing each other frequently, being with each other frequently, created so much of conflict mentally that we didn't want to talk to each other. Because many of the youngsters tell me, what is the point? They don't understand me. Many of the children say they don't have even time to talk to me. So as parents, we as adults, important, talk to them regularly. And if they have doubts and questions, because as I said, there is a lot of infodemic along with the pandemic. And that is a tragedy, because pandemic we cannot stop. But infodemic is something which we can stop if we make a choice. So much of information from unauthorized people, right, wrong, everybody thinks it, just to forward makes them feel good about doing their part of the responsibility. But I always say, whenever you forward a message, first check whether it is really credible, whether it is really true, whether is it worth forwarding. If not, better not send it. But these days, when we are loaded with these type of information, our children, teenagers have lot of questions. Don't dismiss them saying that is a dumb question, or it is useless, or why you are reading all this. It is, it is not making any sense. Any question that the child asks, let the child feel that yes, I'm not asking a dumb question or useless question, because the child is looking for certain clarifications. Where will the child go to? The best safe environment is to the adults at home. Because if we don't answer them, they will still have questions, and they will look at the means which may not be the safe to answer their queries and questions in mind. So my dear children, also, if you have, right now confusion and questions, the best, safest place is to talk to your parents, to your teachers, and definitely if you have good mentors in your life. I always, whenever I take sessions for parents, I always tell them, pray that your children may be guided to good mentors, because everything they may not feel comfortable to ask their parents. But if there is really a God-fearing mentor who guides the youngster in the right path based on a faith-based lifestyle, definitely our child is blessed. So if children have questions, feel free to ask to the trusted adults around you. Next is, how do we ourselves as adults model the emotions at home? We are loaded and bombarded with informations, news, and all these things sometimes just makes us go crazy. And because of that, we responded so negatively in our discussions at the dinner table, or just a casual chat that the family is having. And that shows us that we are always agitated, or we are always anxious, or we are always in a fearful mood. The little child who's watching us constantly is getting or absorbing this kind of an emotional reaction that we are showing. So can we be, as adults, be positive role models in our child's life so that they can model those emotions themselves in their life? Very important. Most of the time when parents come or children come or as a family, they come for a counseling because a lot of conflict happening between the parent and the child. I'm able to see the child is actually not doing anything new. The child is actually repeating what is being communicated at home from the parents. So let us evaluate, how do we model emotions so that our kids pick up the right way to express and manage their emotions. Next is maintain positivity. Yes, there is pandemic around, there is sad news around, there are things which is disturbing us around in the outside world, probably which you and I cannot control to a great extent. But what can be controlled within the four walls of our house is under our choice. Let us find joys in small things. When Ritti called me for this meeting, when he was talking and explaining to me about this meeting, I was just checking with him, how is life and how are you all doing? He said, oh, we have got together as 3 young families, and our kids are also together. Each of us are just having a good time, which we used to have before pandemic. These are the small ways, or we can still celebrate and have little joys in our life in spite of the pandemic that is going on around. But what has happened is, most of us are just closed doors, restricted ourselves from any kind of interaction. It is just physical distancing, but social connect still has to be maintained, because that is how God has created us. If we have to keep our minds and emotions in the right state, it is important we stay connected to each other. And this is the way that we can create small positivity in homes. We don't have to go to, maybe we are the people who used to go to Singapore and Thailand for our big resorts, and where we spent time as a family. And this time is not allowing us to do that. So we don't just mourn over it and sit in the room very sad. No, we still have to find small joys within the limitations that we are going through. So try to maintain the positivity, evaluate, as children also, even though you are not able to attend the physical birthday parties or interact with your friends, how are we using technology to interact? Because most of the time we are glued on the screen, doing things or reading things or involved in things which is not actually adding to any creativity or positivity. So let us make that conscious effort of connecting to others so that small joys of life can still be maintained in spite of the situation around. Maintaining healthy routines is a challenge these days. Doctor also reminded us about how we have to maintain healthy routines. It's like proper diet and also sleep and doing the activities where it has to be done in the right time. These days, many of you are going and attending, many of you are attending the online classes, and there are parents who are reaching out to me how to help the children who are in the early years, because last year definitely it was a much more of a fear factor of sending kids to school or even having online classes for the smaller ones. But right now, after 1.5 years of sitting at home, and even at this phase where the pandemic does not seem to be subsiding in a way that we can immediately start with the schools and all, so parents are worried. How do I still continue to help my child with the academics? So I tell them, yes, the school is sending videos or material for the kids to understand and study at their own pace. It is becoming the parents' responsibility to teach them whatever the school is studying. But one thing I tell them is stick to the routine. For a child of 4 years, 5 years, it is important that the child realizes or the physiological clock of the child becomes accustomed to the routines of the day. How it is? If the child is supposed to do a particular activity that the school has sent, make the child sit every day at 10 o'clock, 10 to 11, so that the child understands this is my school time. Right now, we will do all things in the morning or we are busy, and then suddenly, afternoon time, 1 o'clock, we realize, okay, today we have not done the study with the child. So we wake up and start doing the activity that the school has sent. Next day, it could be 4 o'clock, and the following day, it could be again back to 9 o'clock. That does not create a biological clock for a child to focus well. We all need a routine in our life so that our body and mind can function effectively. Recently, so many students who have been coming to me, especially the college students, they have been telling me about lack of sleep. And because of lack of sleep and so many other reasons, they themselves have diagnosed that I'm going through depression. These days, everything comes from the Google search. So they themselves, diagnose I'm going through depression. First of all, that vocabulary is not to be used so casually. Yes, you are going through a low phase. You are not feeling motivated to do certain things which you enjoyed. You are not feeling motivated to interact with your friends, but that does not classify you into depression. So avoid using these type of strong words casually. Plus identify what can I do within myself to change the mood or to make me feel motivated to continue with my regular activity. So recently, one of the student who came to me, who was studying for his engineering second year course, he was saying that yes, I'm going through depression, and he had all his reasons. I checked his routine. I asked him, what time do you sleep? And his response was, I go to sleep only by 3 o'clock in the morning. Then what time you get up? He said, next day, 12 o'clock. What time is your classes? I would have already missed 1 or 2 classes in the morning. Rest of the class I attend. And then what makes you feel sad and demotivated? Because I'm not able to focus or catch up what is going in the class. I just told him, first of all, the first strategy is just change your sleep pattern. At least go to bed by 11 o'clock. Try to get up by 7:38 so that you have a bigger amount of day with you and you are able to have at least all 3 meals at the right time. Most of the days, students these days are missing breakfast because of the sleep pattern, irregular sleep pattern. And that itself is taking a toll not only on the physiology of the body, but also in the mental health. So maintaining healthy routines, just because we don't have to go out, dress up in our uniforms or catch bus and go to school, does not mean that we don't have to take care of our routines. Even if it is an online class with our videos off, if we want to focus the best possible way in our online classes, important, have your morning routines before you sit for this. Otherwise, your physiology and mental health does not correspond or cooperate with each other. Consistent discipline. This is mostly for the parents, which I want to mention here. What are the disciplinary steps that we are taking? Because most of the time, these days, parents, even as parents of children, even as young as 6-year-old, they seem to say, बिल्कुल भी नहीं सुनता, मेरी बात नहीं मानता. 2 days back, we had our a session for the parents for whom we are starting the online classes of the Montessori kids. So you can imagine it is all less than 5 years old. And then one parent is coming with a child and she's saying, madam, आप school शुरू कर दो, क्योंकि ये मोबाइल उसके हाथ में देता है तो खेलने लगता है. He doesn't concentrate on the activity that the teacher is doing in class. He starts playing, or he's more interested in playing on the mobile. And I said, what do you do? मैं बोलती हूँ, but he doesn't listen. My question back to that mother was, if a 5-year-old child is not able to listen to you today, how will you manage this child when the child is 10-year-old? My dear parents, have a consistent discipline pattern at home. Probably we change our discipline based on our busyness and on our moods. Some days we just ignore, okay, if the child is playing online games for 4 hours, 6 hours, let him play because I am busy today. Next day you are free, so then you want to take away the mobile from the child, and you get really overly angry when you see your child playing over the mobile when he is supposed to study. So your inconsistent behavior actually does not help the child, and it gives the privilege for the child to continue to be indisciplined. So as parents, so many things have taken a toll, so many things have gone out of control, but let us maintain consistent discipline in spite of the lifestyle that we are going through right now. Another important thing is, do we have screen times, rules, and discipline? I'm sure most of us are reading about the news that is coming up about how in different ways our teens and adolescents, also kids as young as 12 and 14 years of age, are affected because of the screen time. See, this is something, gadgets was something which we were able to take it away before the pandemic. But right now, with everything that is online, we are forced to give it back. But even when we are giving it back, do we have some screen time rules and discipline? I'm talking to so many families who are having constant fight with their 13 years, 14 years old children, and parents are finding it hard to manage. My dear children, many of you have a question that online game or spending time so much on online is not going to affect us. I even had a child who was asking the mother, give me a proof on a game affects negatively. I said, come and meet me personally. I will give you enough of proof. These days, there are enough of proofs where children Hello, can you hear me?
Yeah, we can hear you.
Yes, we can.
Oh, yes, thanks. We went off, so sometimes that also becomes a challenge. But yes, so do we have a screen time rule and discipline at home? We cannot avoid the online classes. We cannot avoid the gadgets now, because this is going to be an in thing for next of the generation now. But we also have to realize, how are we going to use it in the right way? As parents, as children also, let us take the responsibility on ourselves, because definitely these type of violent, aggressive games are going to affect us emotionally and definitely going to change our personality. I'm sure you have heard the news of one of the incidents that happened in Kerala, a 14-year-old child who committed suicide because his parents, stopped him from playing the game. And the parents definitely are heartbroken. There is so much of report or investigation and all so much of news out in the media to make both the parents and children aware of the negative effects of how these kind of online games are affecting the children emotionally. So this mother was actually crying over the media, saying that these games, Free Fire, PUBG was banned, and after that, when this came in, that has taken on a higher level than PUBG itself. So this mother was saying all these online games should be banned. But many of the people or people interviewing her said, games can be banned or cannot be banned, but what happens at home is an individual choice that the parents or the teachers have to take. Because even if these games are banned, there will be so many other things in this online world which is going to affect our kids. So my dear children who are listening to me, if we think that this is not going to affect us emotionally or it will not change our personality, it is a myth. Definitely, when our thoughts are constantly, when our minds are constantly filled with thoughts of how I can manipulate the situation to kill somebody, to get rid of people, to eliminate people, to get more points. This is what the thoughts keeps running in the back of my mind, even when I'm sleeping. So obviously, there is a shift in my thoughts and there is a shift in my personality. So children listening to me, parent listening to me, have we set screen time rules and discipline at our homes so that it does not continue to affect us negatively? The most important, this is a generational defining moment. And I will conclude with this. This is a generational defining moment. What do I mean by that? This pandemic has taught us so many reasons, so many lessons. And I would want the children to journal these lessons, because as human mind, our human mind, the memory is very short-lived. Our tendency is to quickly forget. When we are out of the situation, we forget that yes, things can be so tough, things can be so bad, and things are so difficult that we cannot handle on our own, and we have to trust in God. That time, we are all in a different mode. But once we are out of the situation, many a times we forget. So important to consider, what is this pandemic teaching me? Because this lessons that I learned during this pandemic is going to build another generation, the foundation of another generation, which will go a long way with the life lessons and the culture that will be created post-corona. After corona, again, there will be a life which will be hopefully free of mask and free of social distancing. But we as individuals, would we have changed for good or for worse, for better or for worse? This pandemic is teaching us so many lessons. What is the lesson I as a teenager am learning? What is the lesson that I as a child am learning? What is the lesson I as a parent or I as a family can teach each other? During this pandemic time, when suddenly the lockdown was announced, in the month of last March and April, so many students were stuck in the hostel rooms or in the PGs because all the transportation was, restricted. And while I was still talking to many of the students who were held up in the PGs alone, and while during the casual chats, many of the young boys and girls shared with me, Madam, this corona has taught us so many lessons, but we also learned one important thing, that we can survive without Swiggy also. We can just have a meal with rice and curd, and that is also fine for us. Many children learned different life lessons. As parents, what did we learn? As a family, what did we learn? This is very important. And I would suggest journal it so that it becomes a continuous life learning for us. This is also the best time to realize that our money does not help. Our bank balance does not help. Our, all the securities that we considered was strong does not help. You just saw the video where the two children shared their experience of how their parents had taught them to trust in God at all times. And probably that is what kept them going even when both the parents were in the hospital, trusting in God. The faith lessons that we the faith lessons that this generation can learn is, yes, we have problems, we have storm around us, but the God in whom I trust is bigger than the storm that is around me. And this is the biggest, lesson that we as adults, the parents and Sunday school teachers can impart to our children. I would conclude with a small devotional story that I read in a book. It says about a father and son. The father was a butcher. Father and son traveling in a small boat to cross a river and go to the other side to do his business. So most of the holidays, the son accompanied the father. One day, while they were returning in the evening back home, it was cloudy. Suddenly it turned dark and it was thunder and lightning, and it felt like the heavens are going to pour down. The sky is going to pour down, and it was heavy rain. The child got scared, looked at the father. He said, "Dad, are we going to drown in this river? Will our boat turn away?" The father lovingly looked at the child, held him closer together and said, "My son, don't worry. God is with us." The child was okay for some time, but as children, we get restless after some time. It started raining heavier. And again, the child asked the same question. Couple of times, the father tried to reassure. But finally, the father took that butcher's knife from his bag, which he was carrying, from the small, bag that he was carrying. And he held that big knife. You know how, big and strong that butcher's knife is. He put it on his neck, and the child got scared. On the child's neck, the child got scared, and fearfully he looked at his dad. The dad asked, "Are you afraid that something will happen to you because I have put this knife on your neck?" The child thought for a while, and then said, "No, Dad. Even though it is a strong knife, but I know the knife is in your hand and you will not do anything to harm me." And that was the big learning lesson that the father wanted to teach his son. Yes, the surrounding looks tough. The surrounding looks totally fearful. The surrounding looks full of uncertainties and anxieties. But our Heavenly Father will not allow us to be broken or shattered. And anything that happens to us happens only with His knowledge. And let us teach our children to trust in God. And that is where this is the biggest life lesson, generational lesson that we can pass on to our children during this pandemic time. So may we sail through the storm with Jesus at the stern, having the confidence that yes, Jesus is still at the stern, takes away all my fears, gives me more, courage to face my tomorrows, that yes, I can face this through Christ who strengthens me. And let us continue to be in these emotionally challenging days, let us hold on strongly to our Master so that we find the strength to sustain ourselves in this time of pandemic. God bless all of us. And if we have any questions and if we have time, according to what the organizers feel, I'm willing to answer. Thank you.
Thank you so much, Reena Kachuma. It was wonderful listening to you once again after a long time. Just as you said, we as adults need to be better role models for our own children so that they would be looking forth to things being done right in front of their eyes, and following the elders would not become a problem for them. I think we all as elders have a greater responsibility than just putting the blame across on the young children, because they are just growing up and they need to have time to be able to grow up in the rightful way. Thank you so much, Reena Kachuma, once again. Now it's time for the question answer session. There are a few questions in the chat box. Apart from that, before I go on to the question answer session, I would like to make a small request to Reena Kachuma. There have been ample number of requests asking for your email ID. Would you share it in the chat
yes,
box so that
yes.
the students and parents can,
Yes,
let's
definitely. And I'm willing to share my phone number also. Just letting you know that I do take online counseling free of cost. You just have to take an appointment through messaging me, and anyone who needs help would be helped. So you can pass on my number, and I will put it in the chat box as well.
so that others, yeah, sure. Thank you so much. That's so beautiful. God bless you, Rina Kachuma, for that. Yeah, there are children in the group, and I would want you to ask a few of my Sunday school students had said that they wanted to ask a few questions. I don't know whether they put it down into the group. Let me see. Okay, there's one question which comes up. Shall I read it out, Rina Kuchuma?
Yes, sure.
It says, many children have lost their parents due to COVID-19. How do we make them realize that it is not a sin that they had COVID? How best we can make them understand that it is just a pandemic?
Good yes, very good question. And also it is it is kind of such a good sense of empathy, because they are able to understand the pain of their friends. So first of all, important as Sunday school teachers, church leaders, spiritual leaders, not to describe COVID or pandemic as a sin right now. Right? Yes, we all know as adults, probably these are all the after effects of how we have abused the environment, how we have abused the nature around us, and that is sin, definitely a sin, right? So, but this is not a time to give justification that this is a result of the sin that we are seeing so many people dying, because most of the time when they see these are all the God-fearing people and who are so dedicated, they are getting affected. So every time in the world there has been these type of catastrophes, and people go through it not because of sin. That's very important to understand, not to mark it in the terms of or create an emotional fear factor, describing it as sin. And very important for us people who are in the spiritual field also, how we are explaining these type of disasters around us. And so children, when they ask, important, God loves us, right? So nothing happens to us without his knowledge. Yes, these are the two basic facts that helps us to stand strong in our faith. So now, why did this happen to this person? We don't have answers to everything, right? It is under divine plan that these type of things happen, and probably this is a way that different people go through different kind of suffering, that others who are left behind also learn a lesson, and also others are able to understand what is our responsibility during this time when everyone is suffering around us. So more than finding the answer to what, why and how of this, it is important, what can I do to help somebody? Because we will never get an answer. To the best of the theologian will not be able to answer, is it because of the sin that we are going through this, or my friend's parents passed away, or my friend's family is suffering like this? We will not be able to answer. But definitely the Bible is very clear and strong, and I always emphasize on the one key verse of the Bible, which is the centrality of the gospel. For God so loved the world that he gave his only begotten son, so that whoever believes in him shall not perish but have everlasting life. It is difficult to see the love of God when we are going through this crisis. But even when things happen, we are not going into perishment. We are still having the eternity with our master. And all this has to be explained as the love of God, but our responsibility when we claim the love of God in our lives. So that's the best way to answer, because we don't have the answer of whys, right? But what can I do during this situation is more important. I hope I have answered that question. And if Joseph Achan also is here, much experienced and in theology and all these, so he would, if he wants to add something, and if there is time, I would definitely ask. But that's what my understanding.
Shall I talk?
Yeah, sure.
Yeah, okay. Well, Dr. Rose and also Rina Kojama, I was listening to both of you all the while. Also, I switched off my camera once in a while. Well, thank you, Doctor. I had a question I want to ask that. People speak about home remedies, having lime juice every morning and also taking inhalation for prevention of corona. That's okay. Uh, just wanted to ask. But Rina Kojama, your message as usual, I've been listening to many messages. Very good. And when you spoke about the parental role, I've been writing articles and also making presentations online, many places. Uh, also want to make one or two things share with the doctor and also Rina Kojama, what is happening to the children's mind. When you mentioned about small little things which need to happen in our small circle, which is our home, see, creating new meaning in relationships. That is the only saving factor. Of course, Sunday school teachers and all can do, but they are not physically there. But in the family where there are 2, 3 people, maybe father, mother, and 2 children, or only one child, they can create a small world and have creative activities which create new meaning in their life. And what we call this new normal situation now, new normal situation, we have to equip our children to be well versed. They already know, only we have to be trained, elderly people. The use of the virtual media for positive things, as you said. You are Google, when you open Google, the title is Ask Anything. That's what it says, and you can ask anything you and get some kind of answer. So everything is available in this smartphone. So of course, there are some people who prohibit, stop some of those areas so that children won't use it. But I don't think that's the right thing to do. Maybe it is, but better to help children how to use it properly and how not to use some of those sites. So we have to equip ourselves in the virtual method, virtual how to do the virtual thing. I just want to take only 1 minute to just before the pandemic started, I was asked to go to US, Atlanta, to take an orientation class for our Marthoma priests. There are 62 of them. Some of them came there newly. That was the virtual church. I took on the virtual church. And the 2 days before I arrived in Atlanta, one of my colleagues died here in Kerala, Varghese Matthew Achan, and I attended the funeral on my laptop, on my mobile. Then every priest says goodbye by kissing the Achan's hand. So I told those 62 Achans that I attended that. When my turn came, I kissed the hand of Givaris Mathiachan's hand, and that gave me full satisfaction of kissing him physically. Most of them laughed it away. Then, of course, then I came off. I gave many examples. But when I came off, many Achans called me. After 3 months, the lockdown came. They called me and said, Achan, now we are practicing whatever you have said. So what I'm saying is we have to equip our children and parents to use these virtual methods, attending worship from home, participating fully rather than, we look at the movies and looking at movies and participating in worship. What is the difference between the two? That kind of things. And Rina Kochama, you spoke about the new generation. I fully agree with you. The post-COVID generation will have new ethics. I'm very sure, new kind of relationships and new means of communication. And I do not know. We have to do it start organizing it at home and in Sunday schools and in schools. Anyway, you are fortunately in a school now. So this is we have not traveled this way before. So we have to design our own ways. Doctor, like you and Reena Kochama, you are the people to guide. That's a tall order, but we have to go through.
Excuse me, Arjun. Thank you so much
Thank you.
for your input.
Vijay, you're
Can't hear.
muted.
Yeah, thank you, Arjun, for all your insight. And due to the time constraint, we would be moving on to the next segment, that is the proposal of the vote of thanks. But before that, I would like to take this opportunity to also acknowledge the presence of Dr. Priya, who is the General Secretary for the Christian Medical Association in India. We acknowledge your presence, ma'am. And moving on to the vote of thanks now, we'll have the man behind the technical system helping us run these sessions so smoothly, Mr. P.V. Josh, to come in and give away the vote of thanks.
Yeah, I'll do that. Before that, there was a question for Dr. Winsley. If you can take that, and we'll go to the wine.
Okay, that was from Tanimuri?
Yeah, please.
Yeah, okay, I'll take that. Right.
So I think the question reads, can the Delta variant infect someone who recently recovered from COVID or different variant? Is that the question?
Yes, sir.
Yeah, that's it.
Yeah. So these are questions. I mean, what we know is if somebody gets infected, let's say with a certain variant, they will have some amount of immunity and there will be some amount of cross protection. But how long that cross protection lasts, we don't know for sure. It'll last, we think, at least for about 3 months. And it will offer some protection. So when I say protection, it may not protect you from developing COVID, but it may protect you from developing severe COVID. So I think that's the kind of protection that we can sort of expect from one infection. And one thing we know, if we have an infection, the protection is not very long lasting. But if you have an infection and then you take the vaccine, then the protection is actually longer lasting. Or if you have the vaccine and then develop an infection also, the protection is longer lasting. So you combine an infection with the vaccine, that's good. It works like a booster of the vaccine itself.
Thank you very much, sir. Thank you for all the inputs. It's indeed a warm and cherished evening with the most valued resource persons, qualified teachers, parents, students, and colleagues. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked hard to make this webinar a success. All thanks and glory be to God for bringing us together to be a part of this digital world, to meet in this platform and learn from great men and women of God. We thank God for Reverend Asir Ebenezer, the General Secretary of the National Council of Churches in India, for inspiring us and constantly pushing us to break all boundaries. Thank you, sir, for all your inputs for this webinar. We wish to thank Dr. Priya, General Secretary, Christian Medical Association of India, for all the support for this webinar. Angelus Michael, the General Secretary for ISA, for leading us from the front. We have been fortunate for both of our resource persons. Thank you, Dr. Winsley Rose and Ms. Reena John. I prefer to call you Reena Kochama. Thank you, sir and madam, for guiding us and equipping us in these difficult times. We need your help in the future too. God willing, we have lined a few programs, so please don't block our phone numbers. Reverend Jyoti Singh, Executive Secretary, Women Concerned, NCCI, my sister, who is always concerned that I spend a lot of time in office and orders for my pizza and cold drinks. Thank you, ma'am, for all the initiative, the planning, for having bird's eye for details and for putting momentum into ISA. Matthew, our Regional Secretary, ISA Karnataka, for the concept and idea. Thank you, Bhai, for the initiative and planning. Please also join your hands together for our Regional Secretary, Biji George, for stitching the program so beautifully. Thank you, Biji Babi. To all the pastors, colleagues, and my friends, teachers, students, and parents for being with us and making this program a success. Dr. Winsley, in your last slide, you showed Corona Pakoda and Samosa. If you can share the recipe, we can try it today. Thank you once again. Over to you, Biji Babi.
Thank you so much, Ritti. Now it's time for the closing prayer and benediction. I would request Reverend Jyoti Singh to kindly lead us into the closing prayer, followed by.
We thank our God Almighty for this time that we had, and we look forward that in the days ahead we are able to equip our churches, our Sunday schools, our homes, and our society much safer for our children post-pandemic and also during the time of disaster management. May we all equip ourselves mentally and physically and seek God's help for it. Let us all pray. Almighty and merciful parent God, we come before you. We pray that you would ensure us to make children visible, their voices heard, and their needs be met. Lord, we pray that you would help us to address all that they require us to do. Recognize that they are our gift from you. They have their strength, but they have their vulnerability due to various reasons of their age, specific need, or home circumstances. Let us not generalize the need of children, but be specific to them. Lord, help us to work in partnership with agencies which are acting for the interest of children, and let our church be instrument to safeguard and give a protective environment. Lord, help us that our acts may not be delayed to protect our children from harm and abuse, but may we be fast enough to take the needful action. Help us to voice out for them as you, Christ, voiced them out. Lord, help us to bring them at the center of our worship as Jesus, you made them stand in the centrality. Lord, help us to reevaluate children's need and to share the information and support a collective, holistic assignment for children's need. Lord, we pray that you would strengthen relationship within families and help children to build. We ask this in the name of the Lord and Savior Jesus Christ, who has asked us to be like them. Amen.
Amen.
Let us receive the benediction. May God make all grace abound to you, our children, and us, so that in all things, at all times, having all that you need, your will abound in every good work and blessing of God. And the blessing of God Almighty, the Father, the Son, and the Holy Spirit, rest and abide with all the faithful, and especially our children, from now till eternity.
Amen.
Amen.
जो